on social media. The first one is just looking at internet data directly derived from these platforms. So I thought we could do it as three separate sections because most of us are we are all aware of CAST checklist, JAMA guidelines. We are all like now we kind of use it every day and we know the components of it. So I thought we'll first go through how these guidelines had formed, what was the framework or background over which these guidelines were formed. Next part, I will appraise one video which these guidelines had actually used at. So, and it is going to be pretty short and more interactive. The last one I thought if we could all appraise one video together, just like an exercise. I don't know when we are going to appraise it again. Okay, so let's get started. So, why the hustle about the whole thing? This is from the same paper in 2017. About 70% of the Indians use social media platforms, while it was only 5% in 2005. So from over 12 years time, from 5% it had jumped up to 70%, which is a steep increase. Of these, about 40% of healthcare consumers, like all normal people who 40% of them actually go to the social media to get all their data about healthcare. And approximately 90% of them not just listen to it but also believe what is being said, which is quite a scary statistics. If you were to extrapolate or find Indian data and Tamil Nadu data, so India this is about 32%, which is not as high as in the West, and about 54 people actually go to social media to find truthful information, a part of which is actually healthcare information. The next three statistics are actually from the Meenakshi Medical College in Kanchipuram, where they had seen that about 86.2% of all those who have a smartphone actually utilize health information from what is available online. And 60% of them did not even validate, meaning they saw something online and they did not even check with a doctor or check with a physician or somebody to see whether it is valid or not. And 12% of these self-medicated based on what was being said. They didn't even feel the need to go to a doctor. With this in the background, now the challenges have moved. Earlier, maybe about 2 decades ago, it was about how do you find the information. Now it is about, we know that information is freely available, but we do not know whether it is correct or not. So we need to look at ways to assess its credibility and relevance. Given these challenges, there have been increasing misleading information online. I'm sure all our parents keep sending us one video, what do you think about this? And that has also been influencing patients' perception, adherence to medical care. And ultimately, we will be the ones who will have to deal with the consequences. Let's say somebody is taking one medicine based on a video they have seen and which is not, and they develop a reaction to it. So ultimately, we are the ones who are having to deal with the consequences of this. Hence, the need of the hour is to develop or framework to help interpret data on these platforms, as well as studies that could keep analyzing them in the reality. So for that, we have picked this user's guide to the medical literature series on social media, part 1. This is to interpret the information available on these platforms. Like Sir had mentioned, Gordon Guy, who had actually authored this, is one of the co-authors of this paper. It was published in the BMJ Evidence-Based Medicine, February 2022. So next we look at how did they come up with these guidelines. So this Health on Net Code of Conduct, discern criteria, the JAMA benchmark criteria, LIDA instrument. These are 4 pre-validated instruments which are used to appraise qualitative data. I will go through each of these. So out of these 4, the discern, LIDA and benchmark, they are actually used to judge the quality of the written and digital consumer health information and website. While the Health on Net Code of Conduct is actually a tool for the providers. Let's say I want to write an article on, or let's say I want to make a video on, let's say, COVID-19 vaccine. So this is actually guidelines to the information providers, that is us, to raise the quality of the data that is available on the net. And it also identifies internet sites that are maintained by qualified people and contain reliable data. So if you rank well on Health on Net Code of Conduct, which means that the providers have followed the guidelines that they have mentioned, and the Health on Net Code of Conduct people have also ranked them higher on it. So this is for the providers, which is the ones who are making the video, But these three are the ones for the appraisers. If you want to appraise a qualitative data, these are the three instruments that we will use. So if you were to look at the components of each of them, I know it's crowded, but just want to look at the ones in red. So the ones on the left is the discern criteria. The middle is the JAMA benchmark criteria. This is the LIDA instrument and the health on it code. So the way these the current guidelines have been brought by is to look at recurring themes in all this. So they had looked at whether they had looked at authoritative, they had looked at attribution. Does it help in decision making? Is it reliable? Is it usable? Accessibility? So these are the ones that are recurring across all four criteria. So based on these criteria, all the components of the four instruments that we had used, the current guidelines have been produced. So at the end of the search, they had come up with four common themes, four themes that would help us appraise this, and this is the guidelines that we look at. The first thing is trustworthiness. We will look at each of them in little bit of a detail. So first, of the trustworthiness, the first thing is the authorship or the source of the content, and determine whether the source has expertise or credentials relevant to this topic. Let's say there are three videos, all of them are talking about cannabis. One thing is by a clinician researcher who is working in a de-addiction center of a tertiary referral center. Next one is by a medical professional not dealing with the de-addiction center. And next one is a common man who just likes science for the fun of it. So obviously they have got different degrees of credential. So we would obviously look at the data which is being produced by this guy who is working in the de-addiction center, and he is a clinician and a researcher. So that is how we decide on whether the authorship is correct or not. The second thing is just because they have given the credentials or they have mentioned the author, it does not always have to be accuracy. So authorship does not always equate accuracy. The second thing is whether the presented evidence is comprehensive and recent, presents uncertainty and be independent of the conflict of interest. So let's say now we are talking about a disease. So when they are talking about disease, we would expect them to talk about transmission, symptoms, prevention, treatment and epidemiology. On the other hand, if they were to talk about treatment, then they'll have to refer to mechanism of action, indications, benefits, adverse effects and efficacy. So depending on what our interest is, we would want to see whether they have discussed all these aspects separately. So let's say with regards to the conflict of interest, let's say there are two videos. One is made by a not-for-profit organization. They are only interested in disseminating cancer-based information. They are mentioning you details about the RCT. They are mentioning you that they do not have any commercial benefit out of it. As opposed to, let's say there is a medical device company which is endorsing a dorsal root ganglion stimulation, let's say for a CRPS. He does not mention the efficacy, he does not explain the benefits nor the adverse effects. Obviously the first one, we would want to look at a video which is described the way the first video is described. So that is the conflict of interest. Next thing is accessibility. So it is the ability to obtain health information from a platform by the intended audience. Essentially what it means is so that if the viewer, like if all of us, are able to easily navigate without technical expertise, and we are also given an option to appraise the credibility. Let's say we have a Twitter post and it is talking about the myths and facts about the cataract surgery, and it is readily available for all general population. Let's say there is a Facebook account, a private Facebook account, where you need to send an invite and then they accept. Although this private one may, even if it does have more information than the Facebook or than the Twitter account, which does not need you to have an account, it is going to cater to lesser population just by virtue of the fact that you need so much more energy to subscribe to that. So although there are some benefits, maybe like privacy regulation associated with closed accounts, but they are restricted to the fact that they do not cater to a bigger population. So that is accessibility. The second thing is, just because it is accessible, it does not mean it is credible. Although accessibility increases credibility, like let's say an open article is likely to be credible that more people are looking at it and they're likely to appraise it. As opposed to a closed article where there are lesser options to appraise it. Next thing is usability. This is whether it's clear and easy to read and understand, and if it helps advance and improve the patient care. So for a general population, a video or an article is deemed to be readable, and because it's at a reading class of grade 6. So if the video is understood by somebody who studied till grade 6 and lower, then it is readable. But this readability varies on who you are going to cater to. It does not have to be understood by somebody who has studied grade 6 if it is meant for a group of doctors or meant for a group of engineers. The last thing in this is privacy and confidentiality. So most of these online portals, some of these online portals want you to give in your personal data while you are subscribing to it. One thing is that it can cause breach of privacy. The second thing is that, so even if they do, we expect them to give us what would they do with the data that they have collected from us. The next thing, one thing that I did not mention is in the usability, if it helped advance and improve patient care. So how do they do that? There are two aspects of looking at it. One thing is they talk about actionable outcomes, which is, let's say you're talking about, let's say there's a video which is talking about cardiovascular diseases. So we expect that man to tell us about how to be fit, help us to talk about weight gain, talk about going to the doctor regularly, talk about keeping BP, everything in check. So it has also got practical aspects to it. The second thing is endorsing a doctor-patient relationship. So that is the usability. We would not want to go by videos that at the end of the video there is no disclaimer saying go to the doctor. If they are giving us misinformation. Let's say there are two videos, like first example will be a video on cardiovascular diseases, and he is telling us you do all this thing, but you please go meet your doctor. As opposed to another video which is talking about epidural analgesia. So this man claims that epidural analgesia is fast, people are doing it for other benefits, and then he is discouraging people from doing it even without mentioning that please go check with your doctor. So that is what it means by improving patient care. Okay. So these are the four, just like we have 3 parts in the CASP checklist. This checklist has 4 parts. One is the trustworthiness, accessibility, usability, privacy and confidentiality. Okay, so that. Now that we know how the checklist is made, we will look at how we can use this checklist to appraise one video.
People also call this domains, 4 domains.
So this is a case, a geriatrician is visited by his friend's father, a retired professor, for a routine annual checkup. During the consultation, he recommends that the professor takes the COVID-19 vaccine. However, he is hesitant and shows the doctor multiple YouTube videos to discourage getting vaccinated. Recognizing the importance of addressing the patient's concern, the doctor conducts a thorough search and finds a video that explains the benefits of the vaccine. He shares his video with the professor to help him make an informed decision. So our question is, did he pick the right video? So I'll just play that video. So let's see if he's used the right article, right video, sorry. Yeah, so the first domain was trustworthiness. So because we are all familiar with the CASP, I tried to make this little similar to the CASP. So I put the hint on the side just like the CASP questionnaire has it. So first question is, what is the source of the content and our qualification of the author transparently reported? The hint for that source identifies name, credentials, affiliation and other important qualification. So in the beginning when I showed you that this is actually posted on a private channel by a 4th year resident specializing in rheumatology, and she is talking about COVID-19 vaccines. Her collaborators were Dr. Zain and Dr. Hetal Patel. She had mentioned that one of them is from infectious disease and another person from the public health. and the animations were from the Vaccine Makers project. She did not in any of her, neither in the video nor in the description, she has mentioned the qualifications and the affiliations. On looking, so when I had did the search, all of them are actually affiliated to the McMaster University. So if you can look at it, she's a rheumatology specialist, and she was initially like into violin, and later she had moved on to this. While this person, she had done MPH, like the public health specialist that she had mentioned, and this man is an associate professor in medicine. And if you can see, there is nobody really from infectious diseases aspect. So in answer to that first question, their names were there was no credentials, there were no affiliations. We had to go back and look at it. But best way would have been if she had put all these data. If she could not have incorporated within the video, she could have put it in the description at least. The second question is, does the author present a comprehensive, up-to-date assessment of the topic? Like I had discussed earlier, depending on what your interest is. Let's say for example, on the disease, they have to describe transmission, symptoms, prevention, treatment. And if it's treatment, you describe mechanism, indication. If you have seen, she had actually described in detail the overview of the functions of the immune system. She had mentioned B cell, T cells, different mechanisms of vaccine. She had spoken about mRNA vaccines, emphasis on different COVID-19, clinical trial that she had derived her information from, the results and the adverse effects. All of them she had discussed it well. The next thing is, are areas of uncertainty presented? Is there a balanced presentation of views? The content is presented, so that in this content is presented in an unbiased manner and acknowledges if there are any knowledge gaps. So she did look at certain areas of uncertainty. She had mentioned that we do not have answers to what would happen to the asymptomatic carriers, the efficacy in children and pregnant women, length of the immunity after the vaccination, and whether high vaccine efficacy rates can be replicated within the general population, and what is the effect on people with medical comorbidities. She did describe towards the end of the video, maybe by around 9th minute, which I had paused. At around 9th minute, she did discuss all these areas of uncertainties. Is content independent of conflicts of interest? Content is not influenced by sponsorship, advertisement, political affiliation. In her video, she mentioned that she is not affiliated to anything. In the description, she has also said, I am not sponsored by pharmaceutical or biotech companies. I receive no money or talking points. So it is evident that she has no conflict of interest. The next domain is accessibility. So for that, the hint is the content is accessible and does not restrict to private users or private support groups. So it was available for publicly, like we didn't have any accounts and we could still access it. So it was publicly available without access restrictions. There are no restrictions to the sources used to derive the content also. In the description, she had given us the links for all the trials that she had mentioned in the video. Next thing is, can the user obtain content from the platform without technical expertise? The content can be accessed via commonly used browsers, mobile technology, other common. It was an open access one. You could easily access it through a normal Chrome or Edge, whichever browser you could use. The next domain is the usability. So for information targeting patients, does the information meet health literacy standard for ease of use, readability? Content is represented at 6th grade level or low. No. So from the video, it is very evident that anybody who studied less than 6th will not be able to pick up anything. They required and employed some basic health literacy. It is not very clear as to who her target audience are. She should have mentioned who she is trying to address. However, she given us more options in the description for users to obtain additional COVID-19 and vaccine information. So if it was somebody, an ID specialist who want to look at more details, then they can look at these links, follow these links and get more detail. But she should have mentioned who her primary audience were. The previous one is for the information targeting patients. So the next one is for information targeting clinicians. Is the information presented without excessive technical or statistical jargon? Language is appropriate for intended target audience. So it appeared like it was intended for patients from the way she was talking. And there was no real medical jargon over there. Does the content have the potential to improve patient care by providing actionable items? Like we discussed in the example when we were trying to set up these guidelines, we discussed if somebody were to make a video on cardiovascular system, the actionable item would be significant lifestyle modification. And we had also discussed what supporting a patient-physician relationship is. The content promotes self-care, healthy lifestyle, or collaboration between patient-physician. So she provided actionable items. She suggested that we should continue to wear masks until we know what happens to the asymptomatic carriers, or until the entire population is vaccinated. So this is the public health aspect that she was looking at. Sadly, she does not endorse the doctor-patient relationship. At no point in time does she say, please go to your doctor in case you need more information. So that is what she had missed out. So last bit is the privacy and confidentiality. So can the users obtain content from the platform anonymously? Platform does not collect sensitive usage data and personal information such as sexual orientation, ethnicity and political views. So users can access these videos anonymously without disclosing the personal information, like we can all do it. So at the end of this, he picked the right video. So he provided a video that satisfied most criteria except for the author's affiliation. Sorry, one thing I did not mention is the fact that the doctor-public relationship was not endorsed. Sorry about that. He should also offer non-social media based sources such as information creation from reliable sources, something like CDC. And at the end of all the information that he gets, and based on the shared decision making, the patient can make informed decision based on his values and preferences. So that's about it for appraising the video. So now if we can all look at it together. So I had picked one video for all of us to appraise it together.
Mercy is loading that. Any questions? For those who came new, there's some handouts slides. This is critical appraisal of social media, YouTube material. So if anybody is interested in those, that's just that. So if you see a video on YouTube, how do we know it's good stuff or something to worth follow? So now the second video, you must watch the video, and Mercy has told us 4 domains. I forgot the 4.
Trustworthiness, accessibility, usability, and confidentiality and privacy.
So just keep those 4 domains in your mind.
There are some more.
We'll watch the video at regular speed, and all of you must make your own judgment about. You can make your own judgment about this video, and then we'll discuss together. It's everybody's opinion.
So when we have information for patients, here the study she had just mentioned what the study showed. Should we expect them to critically appraise the study also?
No. This is where people just give the opinion. They're not. The next piece is when people share trial data and discuss data. Today is just saying do this, don't do this. So how are we comfortable when somebody comes on social media and says do this, don't do that? The next week will be when they come and share data from a trial and then say do this, don't do this. Today's is just a trial.
Now I just want you to look at the description. It says you can download his food journals. He's advertising for some protein bars. And then he's got the description of the study. And then lots of his work. This is now we will all appraise it. So I had just put the hint and we can answer the question. So what is the source of the content and our qualifications of the author transparently reported? So this is the
Ask the audience. You can go on now.
Credentials have not been mentioned. He just mentioned he's Dr. Dad. Oh, he said.
So this is in the description he's given this. This is in the front of the channel. In the channel details he's mentioned this.
Anybody has a question on that?
He is a pharmacist. How reliable is a pharmacist? That's questionable. He is only interested in obesity management and medicine. But I mean, I googled him. There are so many dances where you can find out what he studied, where he studied, what he does otherwise. So he says he's interested in teaching, and hence he's made a lot of videos based on what he's understood from the clinical trials. So he calls himself the obesity expert. So it's on a private channel by a pharmacist. He's an expert in obesity management, credentials and affiliations.
The problem is he's a self-described expert in obesity. It's not that I have done this course in obesity or so. Be careful. We are not saying that he will be a great expert. You have to put that I studied here and I have done this. Otherwise, every pharmacist in India is also expert in every disease. No? I have cough, okay, here's the medicine for you. So I'm not saying Dan is like that. But we should be careful when somebody says I am an expert. We have to give the credentials to. He has not provided his credentials. Maybe he has received some training in obesity. Okay.
So qualifications and affiliations were not mentioned. So the next question, does the author present a comprehensive and up-to-date assessment on the topic? So this is what it is. This is the hint for that question.
Why they use it initially, whether it's possible using methods in a CK patient and
What did you feel, Christina?
He will provide the latest data or the
Symptom, science, mechanism, all he has mentioned.
not everything.
Okay.
So he has mentioned few details on epidemiology, trial details, outcomes. What could have mentioned is physiology, mechanism of action and symptoms. So maybe he had mentioned a few and then he's missed out on the other things. Are areas of uncertainty presented? Is there a balanced presentation of views? Joseph?
Did he give any uncertainty? Did he present this? We don't know. In the previous video, she said, we don't know about pregnant women and children. Was there any uncertainty at the end of this talk? Or areas of not certainty?
Around 8th minute, he does say that he has discussed. One thing is he did not. One thing we need to remember is that if he is completely supporting it, is in complete alignment with the paper. He had discussed the downside to composite outcomes. The other thing that is mentioned by around 8th minute is that he said we do not really know why it is protective in kidney function, and he's given us a plausible explanation, maybe inflammation, it is reducing the sugar and hence maybe the kidney function is preserved. So he did mention certain things. So next thing is content independent of conflict of interest.
What did you think about conflict of interest? What would be a conflict of interest in this situation?
So if the trial people has
Conflict of Dan. In what way is Dan conflicted? Suppose Dan had shares in Mozambique, then is it a conflict of interest? So he has to share his own conflict of interest. Was there any?
So he didn't mention that, but otherwise I found there were a lot of red flags in the way. So at least thrice in the video, I had skipped at least twice. He had mentioned about weight loss and his other programs, some diarrhea program, some constipation program. He kept saying ring the bell, benefits associates, subscribe to this channel. You all know the more the subscribers, the more money he gets paid. YouTube pays him for that. So more, like in a 12-minute video, he had spent at least about 1 minute and 20 to 30 seconds talking about his own channel and what benefits you will get by subscribing to his channel. So he'd also use a video to advertise some protein bars in the description. Yeah, so I thought this was a major red flag. Although he did mention about conflict of interest with regards to drug per se. He had other personal gains, it appeared like.
So you should be careful. Suppose I have shares in Mozambique. I need not mention it to anybody, but the video I will discuss in the trial. I am an independent person, and I won't highlight the negative parts or the conflicts. I mean, where the study is going to be a bit cautious. We didn't talk about NNT of 22 and say it caused 1 lakh a year wasn't big. You had to pay 22 lakhs to prevent one person from getting kidney. So he didn't highlight the cost aspect of it. Maybe he didn't want to, he does not need to do everything that we want, but we had to worry that was it because he had some conflict of interest. He could have stated, I have no conflict of interest. The previous video, he clearly stated, I have nothing to do with vaccine or any other thing. That conflict of interest could have been mentioned.
Accessibility, content is accessible, does not restrict to private users. Okay.
Accessible content.
I didn't have to use a special login, YouTube login to find that. So
So you should be careful. Sometimes there are groups where we have people who don't believe in this. So only people who believe in that can subscribe to our channel. That becomes like a closed grouping. All people who agree only go there and they keep on agreeing with each other and the whole idea keeps going there. So be careful of those kind of groups where they only one idea. Anybody says an opposite to you can't join it. But this is anybody on the net can see. So accessibly, what would you say? Good? Okay.
it was publicly available with so only thing was the links to the original content were not provided in the description.
The NEJM studies was
He is not put it.
Ah.
Like the previous lady had all of them in her description, but this man did not have any of those in the original content. Links to the original content were not provided. Can the user obtain content from the platform without technical expertise?
What would you say? You have to open your mobile phone, put the same thing and you can get it on phone. So there's no technical expertise required. That's generally okay.
So we just have to use Chrome here. Usability here. For information targeting patients now, does the information meet health literacy standards? Which is, can somebody who's done 6th grade and lower read this or understand what he said?
What would you think? For a 6th grade person in US, understand this? Less than 6 or less? No? So I think that will be generally a difficult thing.
So I thought it was no. Also, if you can compare and contrast with the previous one, she had more information that followed. The links that she had, 2 of them are NEJM, one of them was a WHO guide for common people. So people could not understand it, they could read from that. So this man does not offer any more options for users to obtain additional information on this drug. He just ended at that. For information targeting clinicians, is the information presented without excessive technical or statistical jargon?
What do you guys think? What do you both feel? Is it too technical for a doctor? Many doctors may not understand number needed to treat or hazard ratio and relative risk. But we may do because we are doing teaching critical appraisal. We have to wonder whether many doctors will be able to understand.
He mentioned number needed to read and then he also
Explain
said
the numbers.
So he said had medical jargon but was fairly well explained. So last thing, does the content have the potential to improve patient care by providing actionable items and supporting the patient physician? So like the example that I had given for the cardiovascular disease is the first part and the second part about the
What do you think, Susan? Does he promote self-care in the video? There was nothing much about self-care. And does he say go and meet your physician and find out whether you should take it?
He does say.
He just mentioned. Okay.
So he did not provide actionable items, but he has advertised his weight loss program, maybe indirectly saying you lose weight, sort of thing. Like he had endorsed doctor-patient relationship in the beginning of the video. He said, if you have any problems, like please go to the doctor. So privacy, last question.
Anybody who has not taken one so far? Okay. Guys, what do you feel? Privacy? Can he find out who you are, who's seen this video?
The overall data you can directly access the video.
No, can Dan find out that you saw the video?
No.
So sometimes websites will ask you to fill some basic, are you male, female, and where are you from or something. That means they can collect some data about you. But
Users.
Just go back to that, that's an important thing. Suppose I search Google for Mozambique and Susan searches, will we get the same Google search answers? We won't get, because Google is actually keeping information about all of us and it tries to move things. During the election season, Google can be paid money so that if I'm towards Republicans, it will start giving me information about how good Trump is. Or if it thinks that I'm pro-Democrat and paid enough money, it will start showing me how good Biden is. So there are subtle things which all happen on the net. It may not be a human being doing that, it may be an AI algorithm. So you have to be a little careful because YouTube is collecting information or Susan has seen this YouTube Mozambique videos. Suddenly you will find in your email inbox some advertisement for Mozambique. What did I get this? That means there are some algorithm which has picked you up and done it. So there may be some information collected with, but I think CMC will see you on who is CU1 like, doesn't know who is CU1 to jump. Whereas if you log in with Thambu or even through CMC, it will recognize and start feeding up that information back. Alright, so overall, what is your verdict on this video?
So of the four domains, trustworthiness, I think he's not past that. Accessibility, yes. The usability, there are two parts to it. One thing is that actionable items were not really mentioned, but he did mention the documentation division. Confidentiality he has checked, so maybe about 6 on the Likert scale on 10.
Let's give Mercy a big hand.